Hi everyone. 80% of the hospital waste which is generated is general waste and the 20% of the waste is biomedical waste. If this 20% of the waste, if it is not managed effectively, this can cause health risk and environmental contamination. So in this topic we will cover proper segregation, collection, treatment, transport and disposal to prevent health risk and environmental contamination. Biomedical waste is any waste which is generated during the diagnosis, treatment or immunization of human beings or animals or research activities pertaining there or into the production or testing of biological or in health camps. Biomedical waste is categorized into four: yellow, red, white, that is puncture proof containers, and blue. In yellow, human anatomical waste such as postoperative body parts, placenta, dead fetus, etc. Next is animal anatomical waste. Then soiled waste like cotton waste, pathological waste, plaster of Paris, knee dressing materials, any items contaminated with blood and body fluids. Then expired and discarded medications, and laboratory waste, and the chemical waste. Cytotoxic waste has to be discarded in yellow, but it has to be collected and kept separately. Next category is red category. It is a recyclable waste. Syringes without needles, IV sets, catheters, gloves, urine bag, IV bottles, suction catheters, Ryle's tube, etc. Next category is puncture proof container. It is a white. Needles, syringes with fixed needles, blades, scalpels. Next category is a blue. It is cardboard wrapped with blue wrappers. All glass items, broken glasses, ampules, lap slides and metallic implants, body implants has to be discarded in blue. In yellow category, human anatomical waste such as human tissues, organs, body parts and fetus. Next one is animal anatomical waste. Third one is soiled waste, items contaminated with blood, body fluids like dressings, plaster cast, cotton swabs, bags containing residual or discarded blood. And the treatment is incineration or deep burial. Expired or discarded medication including antibiotics is discarded in yellow bin. Next one is the cytotoxic drugs. These are including all items contaminated with the cytotoxic drugs along with the glass or plastic ampules or vials, etc. Treatment is incineration. Linen, mattresses which is contaminated with blood and body fluid to be discarded in yellow bag. Laboratory waste such as laboratory cultures, stocks or specimens of microorganisms need to be pre-treated to sterilize with the non-chlorinated chemicals before sending to final disposal. Chemical waste such as discarded disinfectant need to be discarded in yellow colored containers with non-chlorinated plastic bags. Treatment is incineration or encapsulations. Next one is a chemical liquid waste, that is discarded formalin, liquid from laboratories and floor washing and clean, etc. This need to be collected in separate collection system that leading to ETP, that is effluent treatment system. Next category is red category. This is recyclable waste. All contaminated plastic items need to be discarded in red color bag. This is examples are IV tubings, sets, catheters, urine bags, suction catheters, Ryle's tubes, etc. and gloves. The treatment is autoclaving or shredding. Next category is sharp container, that is puncture-proof, tamper-proof, leak-proof containers. Do not use plastic bottles to discard the sharps. Waste sharps includes needles, syringes with fixed needles, needles from the needle tip cutter or burner, scalpels, blades. This includes both used, discarded and contaminated sharps. The treatment is autoclaving or dry heat sterilization. Next category is blue. All glasswares, broken or discarded and contaminated glass, including medicine vials, ampoules, except those who contaminated with cytotoxic waste and metallic body implants. The treatment is disinfection or through autoclaving or microwaving, then sent for recycling. These are the labels for biomedical waste containers or bags. General waste is categorized into dry waste and wet waste. Dry waste includes newspaper, cardboard box, plastic water bottles, any cans or soft drinks, packaging materials. Then the food containers after emptying residual food. Next one is food waste, that is a wet waste, and this is a biodegradable waste. Steps to manage the biomedical waste. Biomedical waste should be segregated at the point of generation by the person who is generating the waste in a designated color-coded bins. Biomedical waste and general waste should not be mixed together. And storage time of waste should be less as possible. Transportation and disposal is done within 48 hours. Only laboratory and highly infectious waste should be pre-treated on site before sending for final treatment or disposal. Provide barcode labels on all color-coded bags or containers containing segregated biomedical waste. General waste should not be collected at the same time or in the same trolley in which biomedical waste is collected. Those staffs who is collecting the biomedical waste should wear appropriate PPEs. Biomedical waste bags and sharps container should not be filled not more than 3/4. Plastic bags should never be stapled but may be tied or sealed with a plastic tag or tie. Replacement bags or containers should be available at each waste collection location so that full ones can immediately be replaced. Color-coded waste bags and containers should be printed with a biohazard symbol labeled with details. Ensure that barcoded stickers are pasted on each bag as per the guidelines. All the bags, containers, bins used for collection and storage of biomedical waste must be labeled with a biohazard symbol. If it is cytotoxic, the cytotoxic labels must be put. No waste should be stored in patient care areas and procedure areas such as operation theatre. All infectious waste should be immediately removed from such areas. Infection control practices for biomedical waste handling. Hand hygiene to be followed before and after segregation of waste and after transportation of waste. Heavy-duty rubber gloves and mask to be used while segregating and transporting of waste. Plastic aprons and closed footwear to be used if a splash is expected. Bags to be tied and to be 3x4. All the healthcare workers involved in the handling of biomedical waste should be immunized for hepatitis B, and the same would be documented in the IPC department and HR department. Tetanus injection should be given for all the staff in the biomedical waste handling, and annual health checkup. Collection and transportation of biomedical waste. Timing for transportation of biomedical waste to the main storage facility is by using dedicated lift or as per hospital policy. Disinfection of the trolleys and lifts with 1% of sodium hypochlorite after transportation of waste. All bags to be marked with the location on the sticker given. Segregated biomedical waste bin if it is 3 by 4 fill, should inform to the concerned ward housekeeping staff. The housekeeping staff should wear standard personal protective equipments before entering the biomedical waste segregation area or utility room. Check for any improper waste segregation. If any such practices take place, it should be brought to the notice of housekeeping supervisor and infection control nurse. Housekeeping staff should not try to transfer any kind of biomedical waste from one bag to the another. Housekeeping staff should tie the waste bag at a segregated waste box only before shifting to intramural transfer trolley and try to remove air or apply the pressure on the bag while shifting the bag to the intramural waste transportation trolley. Waste transporting personnel and lift operators should strictly advise to use PPE while transporting biomedical waste from the dedicated lift. Thank you.